Understanding and Preventing Aneurysms, a comprehensive guide. Aneurysms are a serious health concern that can lead to catastrophic events such as strokes and sudden death. Unlike heart attacks or strokes, which often present warning signs, aneurysms typically show no symptoms until they rupture. This rupture can cause immediate and severe health consequences, including death. Understanding what aneurysms are, the risk factors associated with them, and the steps you can take to prevent them is crucial for maintaining your health. What is an aneurysm? An aneurysm is a localized, blood-filled balloon-like bulge in the wall of a blood vessel due to a weakness in the vessel wall. Aneurysms can occur in any blood vessel but are most commonly found in arteries. The most significant risk associated with an aneurysm is its potential to rupture, causing internal bleeding that can be life-threatening. Aneurysms are classified based on their location in the body. 1. Cerebral aneurysm. Occur in the brain and can cause a type of stroke known as a hemorrhagic stroke if they rupture. 2. Thoracic aortic aneurysms, found in the part of the aorta running through the chest. 3. Abdominal aortic aneurysms, occur in the part of the aorta that passes through the abdomen. 4. Peripheral aneurysms, occur in arteries other than the aorta, such as the femoral artery in the thigh or the popliteal artery behind the knee. The symptoms of an aneurysm vary depending on its location and whether it has ruptured. However, many aneurysms do not produce symptoms until they rupture. Early signs and symptoms of aneurysms. Aneurysms often present no symptoms until they become critical. However, there are some signs and symptoms to be aware of. 1. Cerebral aneurysms. Unruptured aneurysms can sometimes cause pain above and behind an eye, dilated pupils, double vision, and drooping eyelids. Ruptured aneurysms lead to a sudden, severe headache, often described as the worst headache ever experienced, along with nausea, vomiting, stiff neck, and loss of consciousness. 2. Aortic aneurysms. Unruptured thoracic aortic aneurysms may cause chest pain, back pain, hoarseness, and shortness of breath. Abdominal aortic aneurysms can cause a pulsating feeling near the navel, deep, constant pain in your abdomen or on the side of your abdomen, and back pain. A rupture will cause sudden, intense, and persistent abdominal or back pain, which can radiate to the legs or buttocks, sweating, clamminess, dizziness, nausea, vomiting, low blood pressure, fast pulse, and loss of consciousness. 3. Peripheral aneurysms. These may cause pain, a lump that you can feel, or occasionally complications due to blood clots forming within the aneurysm. Types of aneurysms. Aneurysms can develop in various parts of the body. The most common types include 1. Cerebral aneurysms. Occur in the arteries that supply blood to the brain. They often develop at branching points of arteries and can be particularly dangerous if they rupture. 2. Thoracic aortic aneurysms. Occur in the portion of the aorta that runs through the chest. They can lead to serious complications, including rupture and dissection, where the layers of the aorta wall separate. 3. Abdominal aortic aneurysms. Develop in the portion of the aorta that runs through the abdomen. They are more common than thoracic aortic aneurysms and can be life-threatening if they rupture. 4. Peripheral aneurysms. Occur in arteries other than the aorta, such as those in the legs, arms, or neck. Peripheral aneurysms can lead to blood clots and blockages in the affected artery. Causes and risk factors. Several factors can contribute to the development of aneurysms. Understanding these risk factors is essential for prevention and early intervention. 1. Smoking. Smoking is one of the most significant risk factors for aneurysms. The chemicals in tobacco smoke can damage the lining of the blood vessels, making them more susceptible to aneurysms. Smokers have a 4 times greater risk of developing aneurysms than non-smokers. 2. High blood pressure. Chronic high blood pressure can weaken the walls of the arteries, making them more prone to bulging and forming aneurysms. Managing blood pressure through diet, exercise, and medication is crucial for reducing the risk. 3. Atherosclerosis. This condition involves the buildup of plaque inside the arteries, leading to their hardening and narrowing. Atherosclerosis can contribute to the formation of aneurysms by weakening the arterial walls. 4. Genetic factors. Family history plays a significant role in the development of aneurysms. Certain genetic conditions, such as Marfan syndrome and Ehlers-Danlos syndrome, are associated with a higher risk of aneurysms. 5. Age and gender. The risk of developing aneurysms increases with age. Men are generally more likely to develop aneurysms than women, although women have a higher risk of rupture. 6. Infections. Infections that affect the arterial walls, such as syphilis or endocarditis, can increase the risk of aneurysms. 7. Trauma. Physical injury to the blood vessels can lead to the formation of aneurysms. This can occur from accidents or surgical procedures. 8. Alcohol consumption. Chronic heavy drinking can weaken the arterial walls and contribute to the development of aneurysms. 9. Inflammation. Conditions that cause chronic inflammation, such as vasculitis, can damage the arteries and increase the risk of aneurysms. 10. Copper deficiency. Copper is essential for the production of collagen, a key component of blood vessel walls. A deficiency in copper can weaken the arteries and increase the risk of aneurysms. Thumb to palm test. One simple test that might indicate a predisposition to aneurysms is the thumb to palm test. To perform this test, try to move your thumb across your palm to touch the base of your pinky finger. If you can do this easily, it might suggest looser collagen in your body, which is correlated with a higher risk of aneurysms. However, this test is not definitive. It is simply a potential indicator, and a positive result does not guarantee that you have or will develop an aneurysm, just as a negative result does not guarantee you are free from risk. Preventing aneurysms. While some risk factors for aneurysms, such as genetics, cannot be changed, there are several lifestyle and dietary changes that can significantly reduce your risk. Here are some strategies to help prevent aneurysms. 1. Quit smoking. If you smoke, quitting is the most important step you can take to reduce your risk of aneurysms. There are many resources available to help you quit, including nicotine replacement therapy, medications, and support groups. 2. Control blood pressure. High blood pressure is a major risk factor for aneurysms. Regularly monitor your blood pressure and take steps to keep it within a healthy range. This can include dietary changes, regular exercise, and medication if prescribed by your doctor. 3. Eat a healthy diet. A diet rich in fruits, vegetables, whole grains, and lean proteins can help reduce your risk of aneurysms. Avoid foods high in sugar, salt, and unhealthy fats. Incorporate foods that are high in antioxidants, such as berries, nuts, and leafy greens, which can help reduce inflammation and protect your blood vessels. 4. Exercise regularly. Regular physical activity helps keep your blood vessels healthy and reduces your risk of high blood pressure, atherosclerosis, and other conditions that can lead to aneurysms. Aim for at least 150 minutes of moderate intensity aerobic activity or 75 minutes of vigorous intensity activity each week, along with muscle strengthening activities on 2 or more days per week. 5. Maintain a healthy weight. Being overweight or obese increases your risk of high blood pressure and atherosclerosis, both of which can contribute to aneurysms. Work towards achieving and maintaining a healthy weight through a balanced diet and regular exercise. 6. Limit alcohol consumption. Chronic heavy drinking can weaken your blood vessels and increase your risk of aneurysms. If you drink alcohol, do so in moderation. This means no more than 1 drink per day for women and 2 drinks per day for men. 7. Manage chronic conditions. Conditions such as diabetes and high cholesterol can increase your risk of aneurysms. Work with your healthcare provider to manage these conditions through medication, lifestyle changes, and regular monitoring. 8. Regular checkups. Regular medical checkups can help detect aneurysms early, especially if you have risk factors such as a family history of aneurysms, high blood pressure, or other chronic conditions. Your doctor may recommend imaging tests, such as an ultrasound or MRI, to monitor for aneurysms. 9. Increase antioxidant intake. Antioxidants combat oxidative stress and inflammation, which can help protect the blood vessel walls from damage. 10. Maintain a balanced diet. Ensure you have adequate copper intake to support collagen production, which is vital for maintaining the integrity of blood vessel walls. Copper can be found in foods such as shellfish, nuts, seeds, and whole grains. By understanding the risk factors and taking proactive steps to maintain vascular health, you can significantly reduce your risk of developing aneurysms. Regular medical checkups and a healthy lifestyle are key components in preventing this potentially life-threatening condition. If you like this video, then join us in making a difference. Subscribe to support our channel and raise charity for a good cause. No donations needed. Your subscription is all we need. Together, we can make a tangible difference in the lives of those who need it most. Let's make every day a step towards a happier and healthier you.